Those of us who make it to age 65, and many of us are already there, on average, we will live roughly another 19 years. And those of us who make it to 85, 50% of us, half of us, will have moderate to severe Alzheimer's disease. I mean, we're not talking an unusual thing here. We're talking about the common cold. What's it going to take for our society to be prepared for that tsunami of dementia, which is coming?
Alzheimer's dementia presents usually with short-term memory loss. But one of the things that when it's initially diagnosed that we try to explain to families is that it is eventually a terminal illness. Cognitive changes with their brain, but what subsequently happens is they lose their ability to function, they become incontinent, they lose the ability to walk, and then they become bedbound.
Alzheimer's disease, I would have to say, is the most feared diagnosis of any that I've encountered in terms of talking with my patients and families. People are terrified of that diagnosis because it's a loss of self. It's a loss of personhood.
In the current medical infrastructure, many of these patients have a long trajectory of decline. It is a terminal illness. The process just takes a long time. And we're not set up to care for many of the special care needs of those patients, which are supportive in nature. The hospice Medicare benefit was developed in the 1980s. It was really thought that this insurance benefit would be primarily used by patients with cancer who, once they begin to decline, have a fairly well understood trajectory of decline towards death.
With all of the advances in medical technology, it's really hard at this point for doctors to prognosticate who has 6 months or less. Some of the hardest patients to prognosticate are the dementia patients.
The trajectory of decline in dementia can take years from diagnosis to eventual death. And many times people will spend many of those months to years at the end stage of dementia.
There's a benefit cap for hospices that deals with how much their overall benefit payment can be.
One of the things that we often see, unfortunately, is a patient who is discharged from hospice ends up in the hospital, and 4 or 5 days of hospitalization with testing is quite a lot of money that comes out of Medicare and really could have been paid for on a per diem rate for hospice.
What we tend to see a lot is those patients aren't off hospice services very long.
We have to come up with a way to deliver that care differently. These are the gap patients, the patients that we understand there's no treatment for, but also aren't dying within the requirements of the Medicare benefit. In the case of patients with advanced dementia, whose goals are to remain at home, and their families are struggling to support those goals, our current system doesn't offer a clear way to continue to care for them. Because I think our current system is built upon medical interventions and less about care.
The hard part in our health system is there's a hole right there for those patients that really want just comfort care, want to stay at home, do not want any kind of aggressive treatment to prolong their life. But there is not a good solution for those patients.
Medicare will only pay for what's medically necessary. So that's a perverse incentive because what gets paid for? The 911 call, the ER visit, the hospital. When I'm an exhausted, overwhelmed family caregiver and I can't take it another minute, I call 911 because they have to take him.
With the dementia patients and these moments of crisis sometimes come unexpectedly. And unfortunately, when a hospice is not involved, sometimes the only choice is to call 911 because the families don't have 24-hour support to help manage symptoms that may occur.
A lot of families will find if they have to go call 911 and go back to the hospital, more aggressive treatment is given than what they really would have wanted. And that's just the nature of going to a hospital.
That's why we spend so much money on on people with end-stage dementia because we abandon these patients and their families, and they will turn to the only place that has to take them, which is the emergency care system in the hospital. And it's bankrupting us as a nation, A, and B, providing abominable care to this growing population of our fellow humans, and soon enough ourselves, who are going to be living for a long time with this disease.